Hello, good afternoon, everybody. Welcome to our monthly endometriosis support group webinar. My name is Bianca Gonzalez, and I'm the Bullying Prevention Program Coordinator with the Riverside Medical Clinic Charitable Foundation. I just want to go ahead and start off by thanking our wonderful sponsors, the Riverside Medical Clinic and AbbVie. We truly appreciate your support. And before I go ahead and introduce our speaker for today, I just want to let everybody know, due to the ongoing concern for our public health and safety, we are just truly fortunate to be able to provide this support group in a webinar format to viewers from all over the world. So for your reference, there will be a short Q&A portion towards the end of the webinar, so please feel free to leave any questions or comments on the chat box to your right-hand side in the lower corner. And then there is an option to leave questions towards the bottom of the webinar as well. So I would like to go ahead and explain a little bit about our presenter for today, Mrs. Wendy Winer. She is an endoscopic surgery specialist and director of research and technology development at the Center for Endometriosis Care in Atlanta, Georgia. She is one of the most well-known and highly respected RN first assistants in the world. She is globally recognized not only for her incomparable surgical expertise and mentorship, but importantly for her gentle, compassionate caregiving. As a registered nurse for more than 40 years, Wendy wants all patients to be the ultimate beneficiaries of her immeasurable experiences and expertise. She's involved in countless committees, associations, and boards, and she was also the first nurse to be awarded the AAGL scarf by Dr. Jordan Phillips for her years of service to the organization, which focuses on the education of nurses and physicians in the area of minimally invasive gynecologic surgery. She has been a featured speaker at numerous professional and patient-oriented events and chaired in faculty workshops for physicians and nurses around the globe in nearly 30 countries. So without further ado, I will now go ahead and give it away to Wendy.
Thank you very much. Hopefully we can talk about something to get your mind off of all of the other things we're consumed with. It's very of us, and this is Endometriosis Awareness Month, but as far as we're concerned at the Center for Endometriosis Care, every day is endometriosis awareness. And I just want to make sure and not spend too much time, because I want to be sure there's time at the end for questions and answers. And so I have no financial interests. And so our objectives for today are, number one, we'll review the definition of endometriosis, which is a systemic and potentially chronic condition. Review with your what to ask the doctor when choosing a physician for your care. Understand how to best prepare for surgery. Illustrate how to, we'll talk about how to enhance healing postoperatively, and discuss, most importantly, we're going to focus on how to advocate for yourself to ensure you are the leader of your healthcare team, because ultimately this is about you. And that's what everyone needs to be focused on, your health and well-being. Just to review, because there's a lot of misinformation out there, and we get questions all the time about what is actually the definition of endometriosis. So endometriosis is a systemic disease, and it is a major contributor to pain and subfertility in women. It is characterized by endometrial-like tissue found outside the uterus. The disease is primarily found on the pelvic peritoneum, ovaries, and rectovaginal septum, but also in less common areas outside the pelvis, such as the diaphragm or lungs and other areas, the bowel, and we'll talk more about that. As you all, I'm sure know, that these are just the common symptoms here are severe period pain in people when they menstruate, abdominal and pelvic pain at any time, bowel or urinary disorders, pain, dysfunction, painful intercourse, pain with using a tampon or anything vaginally, infertility is possible, pregnancy loss, all these different things, possible immune-related and other disorders, coughing up blood in the most severe cases of pleuro and thoracic endometriosis, and leg and lower back pain, particularly in cases of sciatic endometriosis. So I'm not going to really go into, more information here about this, but to get more information, accurate information about the actual definition and symptoms and what to expect with endometriosis, I would encourage you to go to the website for Center for Endometriosis Care, because we have a lot of really good information there. And you can always reach out to me too for more information. So we'll just kind of go through that. One thing that we're very particular about too is all tissue that we excise, we send to pathology to help us get a definite diagnosis. But we will also talk a little bit more about that too. So let's talk about patient-centered care, because I think that is one of the things that I feel very, very strongly about, that our focus is on our patients' well-being, our patients' safety, and getting you to feel better and have a good quality of life. And that is something I believe strongly in, and that is something we believe in very strongly at the Center for Endometriosis Care. And so I think that when you're looking for a physician or treatment or more information about endometriosis, it's very important that you talk to people who are really focused on what's best for you. Because what's best for me may not be what's best for you. All we can do is give you all the information and combine that with your symptoms, but ultimately you make the decision and we'll help you in any way we can. So by definition, patient-centered care is that which honors patients' preferences, needs, and values. It applies a biopsychosocial perspective rather than a purely biomedical perspective, and forges a strong partnership between the patient and clinician. And that's what we really try to focus on. It's imperative for all health systems for all healthcare and health systems to practice, from solo practitioner to a large multi-specialty group to federally qualified health for it. More detail on all of that. And this is a chart that basically outlines a lot of things that are in the research that you can look up about patient-centered care. But basically it talks about the entire team and everything, every single person that you deal with needs to be focused on you and your care. So once again, patient-centered care, specifically in endometriosis, is the management should be shaped on the main clinical problem, taking into consideration a woman's preferences and priorities. So what your preferences and priorities are. And quantitative information should be provided to describe the potential benefits, potential harms, and costs of each treatment alternative. Counseling should be complete and transparent, and the duty of the caring gynecologist, as well as the entire team, is to inform the woman on the pros and cons of each option and support you as a female and your significant others and the people that are with you in the shared decision-making process. But ultimately, the decision is you as the patient with your clinician. But it's what the goal is, to give you the treatment and care that you deserve and that you want for your situation. The physician should be able to look the patient in the eye and explain in detail all the available treatments, and not only those that the physician prefers or is able to offer. So that's something we'll discuss more when we talk about advocacy. I don't want anyone to ever be afraid to ask for what you want. And that's really the focus of what we're going to talk about today, is that you, and hopefully you, as well as all of the different support groups for endometriosis, we're all focused on supporting you and getting you the care you want. And based on what you want your lifestyle to be, or what your lifestyle is, or what you want, what your priorities are. And even when I mentioned your significant other and your support system and your family and friends, but ultimately it's you. So all we can do is give you all the information, and we want you to have all the facts, and then you make the decision of what it is that you want. And patient-centered care teams improve outcomes. And we've done a lot of research on this, and a lot of other people have, and we continue always to do research and to talk to our patients, to follow you, not just short-term, but indefinitely, forever, really. But a lot of it studies show that it will reduce, these are the things we're trying to focus on, to reduce the time for your diagnosis. So many patients have waited 8, 10, and more years for diagnosis. I mean, I've even heard 30 and 40 years for diagnosis, which is, awful. I mean, beyond awful. But the sooner you can be diagnosed and treated, the better. And that's one of our very high goals. I know, like at Center for Endometriosis Care, that we really want our patients and everyone, women, to be educated globally about endometriosis and to get early diagnosis. The sooner the better. And it doesn't really matter if in a teenager, if you have the symptoms as a teenager, the sooner you can be diagnosed and effectively treated, it's going to be so much better for you. Increasing disease awareness through education, improving outcomes with thorough excision of the endometriosis scar tissue, empowering patients, patient advocacy. So just to talk a little bit about, I just want to talk, I slipped through this quickly, but endometriosis treatments. And here, as far as diagnosis, endometriosis is a surgical diagnosis. Anything less than biopsy confirmation is considered uncertain. Physical exam has poor sensitivity, specificity, and predictive value. I mean, a lot of our patients, it's very important we get a good history, but sometimes we can't really do as thorough a physical exam as we'd like because either patients are in too much discomfort. And we feel very strongly about doing a vaginal ultrasound in our office if you're age appropriate. But, even if you can't tolerate or don't want a vaginal ultrasound, we can do an abdominal ultrasound where we don't use a transducer in the vagina. So, I mean, we tailor it to whatever is best for you. But it's important, I believe, that the physician, the gynecologist specifically, is the one who does the ultrasound and matches that as part of his or her exam. Then, as well as combination of the history, physical exam, lab, diagnostic studies, all of these may help rule out non-endometriosis concerns. Imaging. So as I said, I feel very strongly about office vaginal ultrasound by the physician. It can help isolate location, specific diseases, and look at your ovaries and rectovaginal septum and different things like that. But it's still not 100% until we actually do surgery and get a tissue diagnosis. And then we can also see what's going on. Absence of evidence is not evidence of absence. So 82% of gynecologists admit to not being able to perform advanced laparoscopic surgery. When in doubt, refer them out. That's something I think is really important for women to keep in mind, that 82% of gynecologists themselves say they are not able to perform advanced laparoscopic surgery. So if you have any doubt in your mind, I encourage you to get a second opinion, a third opinion. You just keep searching, and that's where you really, really got to be your own advocate to get what what you deserve in your care. So just to get even more specifically, when I talk about laparoscopic excision of endometriosis, that is, by definition, permits both diagnostic confirmation with a biopsy, which is where we send tissue to pathology, and the treatment, thorough excision of the disease. The most effective way of treating both superficial and deeply invasive disease and allowing for histological confirmation. So that is what we believe the thorough laparoscopic excision of endometriosis is what I'm talking about when I say the most effective way to treat the disease. And ideally, you want someone who is, well, not just ideally, you do want someone in no uncertain form that is an endometriosis excision expert. And that this is what we focus on, this is what we do every day. But the key is that you have your endometriosis thoroughly excised, which means you have to have wide enough excision, deep enough, and the only way the surgeons really, your gynecologist is going to know how to do that is you really need someone who has been doing this for years, and this is the focus of their entire practice. Ideally, that's what I believe is the best. So, I mean, there are other ways that people, other treatments that people have tried that I personally feel very strongly do not work. Different types of hormone treatments, GnRH antagonists, and a lot of those things, some of them may give you some very, very temporary relief as far as your symptoms, but they will not get rid of your endometriosis. And the even bigger concern is that the side effects that many of these medications will cause, and some of them are irreversible. So that's a huge concern. And they're not going to get rid of your endometriosis. So I think that's something that you really need to be aware of. So the treatment of the excision of endometriosis is one component of your treatment. There's a lot of other things depending on your situation that may include after surgery, pelvic floor therapy, pain management, all different kinds of things, different modalities that can be used, meditation, yoga, breathing exercises. And we're learning more and more. Diet and nutrition, I think, are very, very important. And a lot of patients find gluten-free as helpful. And you really get to know your body because what works for you may not work for everyone. And that's something that we're learning more and more about. But I think drinking lots of water is really important. Staying away from a lot of artificial things and things with preservatives as much as possible. If you have, for instance, a lot of frequent urinary tract infections, I think it's really important to drink cranberry juice or things that are more alkaline and not as acidic. So different things like that, depending on your particular situation. A lot of our patients, it's very common for endometriosis patients to have issues with diarrhea and or constipation. And I'm always looking to have a patient try to regulate that with their diet. Constipation is very common, so I think it's really, really important to have plenty of fiber in your diet and lots of fruits and vegetables, and to try to address these issues without having to take medication. And then combination therapies, oftentimes we have to work with several different groups, or we make a lot of suggestions for sending you to a pelvic floor specialist and work with all these different areas together, as it's all part of our team. No matter where you are, we have contacts all over the world. So we'll work with you to get you the best follow-up care, no matter where you are. And the role of support groups, psychological support, definitely cannot be undervalued. And one thing I want everyone to keep in mind, you are not alone. Don't ever, ever let anyone tell you that this is in your head. I have a real pet peeve about that. And we still see patients all the time that have been told it's in their head. We do surgery on them and they have stage 2, 3, 4, stage 1. I mean, they have endometriosis. I mean, it's not in your head. So don't let anyone tell you that. And don't ever feel that you're alone. There are so many support groups out there, and there's so many online blogs that are incredible, and they're getting better and better. There's more and more of them all the time. And years ago, patients weren't fortunate enough to have these types of things, partially because we didn't have access to the internet. But you also have to, by the same token, be careful that everything you read on the internet is not necessarily accurate. So you kind of have to really work hard to educate yourself and to that's one of the reasons we have so much information on the Center for Endometriosis Care website to help get you good information out there. And believe me, if you find something that will help other patients, we want to know about it. We're constantly, I'm always asking patients all the time about different types of treatments or different sites, because I am constantly learning from all of you as well. And so I think that's really, really important that we're all working together. But you are not alone. It is not in your head. What I always tell healthcare professionals, because I speak a lot to gynecologists, physicians in all specialties, and all allied health professionals about the care of our patients. And I constantly hear from patients that there are people in all different areas that don't really get it. They don't really value what you're saying. And what I tell everyone that I talk to is, I said, just stop for a second and think about who is the person in your life that you care about more than anyone else, that you love more than anyone else, that's the most important person to you. And I want you to take care of your patients that way. And that is something that I really strive to do every day. And I've been on both sides of it. I've been a patient, I've been a family member, I've been, obviously a clinician, but there's a lot of people that have never been in those other situations, or they disconnect and they detach themselves from it. And I said, no, you have to take care of your patients the way you or the person you care, you would imagine how you would feel if that was your parent, your spouse, your partner, your daughter. And I really try to emphasize that. And I think it's important that that's just how we treat others in general, no matter what the scenario. And I'm not going to talk too much about this because I really wanted to get to the real important part about advocacy. But just a little bit quickly, I'm a registered nurse first assist, so I first assist in surgery all the time. But I'm there talking to the patients and families before surgery. I'm with you during surgery, obviously, and after, and the follow-up care. But I really encourage everybody in the operating room to be professional, to have empathy and compassion. And I always want to know about it if there's somebody that's not doing that either before, during, and after surgery, because we want everybody to do that for our patients. That's just really, really, really important. Anesthesia, patient positioning, we're really careful about patient positioning. We have also an anesthesia team that works with us regularly, all these different things, but positioning is very important as far as protecting the patient's extremities, their arms, legs, everything during the surgery while you're asleep. Patient allergies, we see a lot more allergies with patients as far than what was reported years ago, because I think people are just more sensitive to a lot of different things, whether it's the PrEP solution, the adhesives, any kind of bandages we use, even as much as a Band-Aid, latex allergies. So make sure that you tell your clinician about any of those things. We're very picky. We have a timeout on every case, and just to make sure everybody's on the same page. And before surgery, obviously in the preoperative area, we're very, we review everything over and over again and make sure the consent form matches up with what you want and what you discuss with your physician, and just to be sure that everyone's on the same page. And efficiency, I'm a big advocate for efficiency, because efficiency, I believe, leads towards better outcomes. And safe, we want the safest possible treatment for our patient with the best possible outcome and experience. That's just a quick picture of one of the operating rooms. And we're very, very fortunate here in Atlanta, because we we work with so many different products and industry, that if we don't have what we want, they'll make it. And we're very lucky because we kind of have the best of the best. And before it's even out there available to everybody else, oftentimes we're lucky enough to get it. And intraoperatively, everybody in the whole room, the whole team, everybody needs to be focused. I'm also an advocate when anybody comes to work, whatever's going on outside of work stays outside of work. When you get to work, when you get to pre-op, when you get to surgery, when you get to the recovery area, you focus on our patients. So we're all focused about everything for our patient. We sometimes kind of joke, and we have we have a great team. We're very lucky. A great team in the office, in the operating room, the nurses and staff that take care of our patients after. We're always talking with them, and everybody's on the same page. That's very important. So so let's talk more about advocating for yourself. That's what's really important. I mean, surgery is maybe the focus of your treatment, but the care you receive before and after is also vitally important to the entire process and helps provide the best possible result for you. And I always like to talk to patients before surgery without even looking at their chart. I want to talk to the patient. I want to hear from you what you're feeling, where you normally have pain, and get a history from you, and just make sure that we're really focused on what's going on with you and what your goals are from the surgery, what you're hoping to get. And then I review the chart and everything else with you. When you see the doctor, though, for your preoperative appointment, or whoever's important with you, that's going to be taking care of you immediately after surgery. I also would encourage you to write down your questions, if possible, before you come in to see the doctor, because a lot of times there's so many things going on in your mind. You get there and you may be nervous, maybe you traveled to get there. There's so many things. Maybe you're having really bad pain that day. There's just too much. There's a lot happening. So I want you to not be intimidated, and I want you to have your list of questions and make sure when you walk out of the office, your questions have been answered. And so when we talk a little bit more specifically about advocating for yourself, some of the questions, because people ask me all the time, what kind of questions should I ask the physician when I go in to see him or her, and what to look for. So this is just a list I kind of have compiled. Ask the physician how much of your practice is dedicated to the care of endometriosis and pelvic pain patients. And you have every right to know that. How much do you do general GYN, and how much do you do obstetrics? One thing, keep in mind, all gynecologists still have to be board certified in obstetrics and gynecology. For years, we've tried, because the specialty of obstetrics and gynecology could easily have 5 or 6 subspecialties, but and one of those being excision of endometriosis. But thus far, it's still the way it's always been, where all gynecologists are obstetrician gynecologists. So What you're really looking for, though, is someone who really, even though they're an obstetrician gynecologist, that they are focused not on obstetrics and not on general GYN, but they're focused on endometriosis within GYN. That's very important. So I would definitely not hesitate to ask that question. And if you've had a baby before, just because you may love your obstetrician, that may not be the best person to treat your endometriosis. Anyways, another question: where, with whom, and for how long did you undergo the training in minimally invasive gynecology? And that's a question I would definitely ask them. What kind of background did they have? What kind of training? Did they do a fellowship in minimally invasive gynecologic surgery? And then how many years after that? Just doing a fellowship, it used to be a year fellowship, now it's a 2-year fellowship, but that is not that's not enough. I mean, this type of, for endometriosis, and especially even the more advanced procedures, I mean, it's something that you really have to focus on and work out for years. And so I think that's important to know. How much of it was dedicated specifically to endometriosis surgery, and was multidisciplinary excision the method of lesion removal used throughout your fellowship? And so there's a lot of places that they just burn the endometriosis, which they call ablation, or they do a little bit of excision and they don't thoroughly excise. And now what's happening is we're finding more and more gynecologists who say they do excision. And you have to remember that all excision of endometriosis is not the same. So you need to ask more questions and find out more about what kind of outcomes they have. But thorough excision is very important. And what we're finding, though, once again, is to keep in mind that all gynecologists that say they're excisionist are not necessarily what I consider an excisionist. So there's different levels of that. And you deserve to know the answers to those questions. How many cases, this is very important, how many cases of endometriosis do you treat annually? That will tell you a lot. How many do you treat medically with just giving them one of these hormones that I was talking to you about, or a GnRH antagonist? Surgically, or both? What are the pros and cons of each option? Do you use pre or post-op medical suppression? That's important to know. Which one? Why? For how long? What are the pros and cons of the suppressive approach? You have to be really careful about this, because there are a lot of pharmaceutical companies that, they've got a lot of money behind them, and they advertise all over the place. And they have a lot of physicians that they pay to seriously take into consideration. Because what you want is, you don't want medical treatment, you want surgical excision of your endometriosis. And you don't want somebody who's using the product just because they're, going to get a lot of money for using that product. And so I think that's really, really important, without a doubt. What kind of complex cases do you see? Thoracic, diaphragmatic, sciatic nerve, all these different kinds of things, bowel cases, and how do you treat them? And it's important to note that not only do you want early treatment, diagnosis, and treatment, but you also want, there isn't anybody out there that wants to have more than one surgery. And so many of our patients have had multiple surgeries by the time they have gotten to us. But the goal is to have one surgery. And so that means you want to go to an excisionist who also has a team. And like we have a bowel surgeon that works with us that's available all the time. We bowel prep all of our patients, regardless of your history, because we want to be prepared if we get in there and find something that may be interfering, that may cause you a bowel obstruction, or something that is contributing to your pain that needs to be, that's more aggressive, that goes through the interior lining of the bowel, that we have a bowel surgeon with us. Most of the time, we can excise what's on the bowel without having to do a bowel resection, but we still, by the same token, need to have make sure, and we talk to you about this all in the pre-op visit so that you know what's going on. But we have a whole team. So we have a bowel surgeon, we have a urologist, we have a thoracic surgeon. Everybody that is available, they're all available for your surgery if we need them. So the team approach is so important. Do you exclusively perform excision to cut out all endometriosis, or do you superficially ablate, as I said before, burn or cauterize? So obviously you want someone who thoroughly excises the endometriosis, and ask them what type of energy sources they use, what type of spread there is from the energy source, all of these things. And then you want to know what their outcomes are. How many of your patients require additional surgery with you or someone else? And what was found on pathology. We send all specimens, all endometriosis, scar tissue, we send all tissue to pathology. So during each, oopsie, let me go back to here, hopefully. Okay, sorry. Technical difficulties there. Anyways, but what are the actual endometriosis recurrence persistent rates in your patient population on average? So those are all things you want to ask. You have the right to know these things. So don't hesitate asking. So anyways, do you engage in a multidisciplinary team, as I said before, with all these different specialties, which we do? And so that's a question, though, that you want to ask of your surgeon. Will you be performing your surgery yourself? That's important because it's important to teach and to have people watching. But first of all, you have a right to know anybody that's in the operating room. And if there's someone observing, you have to sign a special consent that says that's okay. But you want to know who's doing your surgery. And that's very important. You want to know who your surgeon is and who's assisting in your surgery. That you have the right to know that. And that's something where the Center for Endometriosis Care, we have the same people, same surgeons, same assistants, operating on you, on all our patients. But you have the right to know that. Are you fully prepared to excise, resect all disease, no matter where it's located? As your surgery intended to be organ sparing? That's something that's very important too, that if you don't want to have a hysterectomy, for instance, then you should not have a hysterectomy. Don't let anybody tell you you have to have a hysterectomy. We will give you all the options, and we will excise your endometriosis as thoroughly as possible. And if you want to keep your uterus, you have every right to keep your uterus. If you want your uterus removed, you have every right to. Whatever it is, we can excise cysts on your ovaries without removing an ovary. But these are all things you want to ask. We see so many patients who have had hysterectomies, who have had their uterus out, their tubes, ovaries, everything out, and they still have endometriosis because the endometriosis was never treated or excised. So you have to remember that these are all questions to ask, and most importantly, you want your endometriosis excised. And there's a lot of different ways we can do that. And do you lyse adhesions? Do you get rid of, when they say adhesions, that's scar tissue. And yes, because endometriosis and scar tissue kind of go hand in hand. So it's not unusual to have endometriosis, to have scar tissue in conjunction or as a result of your endometriosis. And you can have scar tissue as a result of other surgeries, but there's a lot of reasons. Do you remove as much of the gas as possible before the end of the surgery to lessen referred shoulder pain? And yes, we always try our best to get as much gas out as possible at the end of the surgery. Do you use adhesion barriers and all those different things, or platelet-rich plasma? And we do all those things based on the situation. Good surgical technique is the best thing, though, for prevention of adhesions. And But in addition, there are other materials that we, depending on your situation, that we discuss with you ahead of time that we could use, and so on and so forth. Once again, you want to know how long you'll be in the hospital, and how can you best prepare for surgery? Are there, we tell we tell our patients before surgery, because we bowel prep everyone, but we want you to be careful what you eat beforehand for several days to kind of reduce your diet as far as stay away from spicy, fried foods, have a softer diet. And then as you get closer, it just makes the bowel prep also easier on you to kind of go towards, clear liquids. But we bowel prep everybody because we want to be able to do a complete excision regardless of where the endometriosis is. Plus, it's also good because you don't want it, we push the bowel out of the way so we can focus on what we need to see. And it's better for the bowel just not to be full with stool, even if we weren't doing a bowel resection. Any tests that need to be done in advance, and a lot of that will have to do also with your particular history. And those are important, though, that your physician is very thorough about that and knows your whole history. So anyways, and post-op things, as I said, with pelvic floor, dietary, all of these different things. And then, you have the right to know and to ask, what if I did have a complication during surgery? And something I often say, I kind of almost don't even like the word complication, because so many of our patients, for instance, have had a lot of previous surgery, and we review everything with you ahead of time, but sometimes, that involves us getting into the bowel. But all of these different things, sure, you can have an adverse reaction or a complication, and getting into the bowel doesn't automatically mean it was a complication, because maybe, that was part of the plan, or that's the only way we can effectively excise your endometriosis. But whatever it is, the key is for us to, for your surgeon to recognize if there's an issue, and then to address it and treat you safely. Those are the key things. So the post-operative management and all of those different things are very, very important. And you want to be sure that you are followed, and you can get back in touch with your physician a week or two after surgery. And even if it's months after and you want to have a conversation with them, you can do that. So as I said before, just to run through here, because I want to make sure I leave enough time for questions and answers, but feel any prescriptions you get from your doctor prior to surgery, go ahead and fill those so you'll have them available. The night before surgery, you should shower. We recommend not shaving the pubic area prior to surgery. No perfumes, dyes, or creams the morning of surgery. In general, I tell everybody anyways, even after surgery, to use unscented soaps, whether it's Aveeno or something like that. Nail polish is fine, but check with your surgeon to see if they have any special requirements. Good nutrition is always important, especially leading up to. Stay away from big, heavy, and spicy meals before surgery. Hydrate well. As I said, more fiber, things like ground flaxseed. Fiber One cereal has a lot of fiber. Read the labels. The reason I say Fiber One cereal is because when I started looking at all the cereals on the market, it has more fiber than the others. But just see. If you're gluten-free, then do gluten-free. Fresh fruits and vegetables is always good. As long as it doesn't bother your stomach, I would consider an over-the-counter daily probiotic. What to put in your bag for the day of surgery? No valuables. No matter where you have surgery, I say don't take any valuables to the hospital. Don't bring anything to the hospital that you don't absolutely need. Travel light. Your phone's okay. You can leave with your caregiver. If you have a pair of glasses, you can get that to your caregiver, or just make sure it's someplace secure so you can get it afterwards and nothing happens to them. Just wear comfortable clothing. Bring ID, that's important, and bring any insurance cards that administration may need for checking you in. But definitely have ID on you and insurance information. Bring some type of recording device. Cell phone's fine. We tell patients after surgery, that when the doctor comes out to talk to the family or whoever's with you, that they can record or video whatever the doctor has to say. So that way you can see all that, even if you're going to have a conversation, obviously, with your doctor later that day or usually the next morning when you're more coherent. It's good because it just, that way you don't feel like you're missing out on anything that they discussed right after surgery when you were, not there. Bring a small flash jump drive or something like that. You can give your doctor or their assistant if you want them to record your surgery so you can have that for your own personal use. Don't forget your companion. It's important for whoever's with you. I always stress too, we need to, make sure whoever your caregivers or your significant others, whatever, that they're cared for too. So they should bring some snacks, a water bottle, have money handy. So if they want to go to the hospital cafeteria, they can go get something. Bring some reading materials, a good time for them to catch up on reading. Hopefully there's good Wi-Fi where they go and they can read and do some work or whatever, and keep them because they may be, maybe a long day for them. After surgery and discharge, I always tell patients, you want written going home instructions, and we give that to you before surgery. But I tell you after surgery, when you get home, to always review those again, because beforehand you're preoccupied with so many other things that it's good to review those things after surgery or when you get home. Definitely do not post things. If you have questions, don't post them on Facebook or social media, because you want to call your doctor's office, because you can't expect us or count on us to be seeing those things. So always, if you have questions or concern, always call us. Ideally, I said, yeah, it's great if you can call during office hours, but I tell all patients, if you have something that comes up, I want to know about it. If you have a question or concern, I don't care what time it is. I want to hear from you. I don't care if it's in the middle of the night, because we want to know what's going on with you. So, if it's something that can wait till morning, great. But if it's something that's that pressing, you call us. That's what we are here for. Have a thermometer. So many people do not have thermometers. I'm telling everybody now, have a thermometer. So when you go home, if there's any question after your discharge, if you have a temperature, just have a thermometer available. Pedialyte, is something that I have a lot of patients take now. If there's any concern about hydrating well or after surgery or getting proper electrolytes, and now you can get flavored Pedialyte that they carry pretty much everywhere. And I just know it's better, in my opinion, than something like Gatorade or just because it's not just sugar and water. At least I know that you're getting electrolytes and not just sugar and water. So flavored Pedialyte is something I would recommend. And hydrating well afterwards is really important. Just don't forget, if you have questions or concerns, or you're not feeling well, or you just think something's not right, or just anything, call us. When to consider going to the emergency department. I tell people, if you ever have shortness of breath, go to the emergency room. If it's shortness of breath, you have any trouble breathing, you go to the emergency room. It could always be something. Most of the time it's nothing, but it could be an air embolism, pneumonia, atelectasis. They give you after surgery to let the ball go up and you exhale. Those are very, very important to use after surgery. And I tell people the first day or two to try to use it every 20, 30 minutes while you're awake, because you might not feel like taking deep breaths, but that's important to do. With no matter what you have done, there's always a risk of a bowel leak or a bowel perforation or fistula. The kinds of things to watch for, though, anytime someone is running a temperature, and especially though, if they're running a temperature of 101 or 101.5, that's my dividing line. 101.5 or higher, I'll send someone to the emergency room. But if you are running a temperature, you call your physician. If you're extremely nauseated, if you are throwing up, if you have terrible diarrhea, any of those things, call us, because that could be the indication of something else. If your bladder feels really full and you don't feel like you're emptying your bladder well enough, you're not urinating regularly, that we want to know about that. And drink plenty of fluids. If your heart rate goes up, that may be that you're dehydrated, but it could also be that something else. So call us. If you have severe constipation, I want to know about it. But you may need to take, in addition to having enough fiber in your diet, if you're taking prescription pain medicines, it's very common to get constipation. So you may need to be on a stool softener or something, some type of laxative. But call your doctor and find out about infection. Another rule of thumb is if patients, you expect that first day to feel kind of crummy, or especially the first day after surgery when you don't have the anesthesia and you're moving around more. But if you've been feeling okay for a day or two, and then all of a sudden you start to really feel awful, or even 3 or 4 days later, you call your doctor, because that may be a sign that something's going on. Because each day after that first day or two, you should keep feeling better and better. You may have some shoulder discomfort from the gas. Patients tell me, some patients think Gas X helps. Some say even real tea with real lemon, heating pad, a massage. Overall, the most common thing that people seem to say that helps is just the sooner you get up and walk around, the fluid, the gas, it's just got to work its way out of your system. And pain medicines aren't going to really help with gas from in your shoulders. The best thing is drink lots of fluids, lots of water, and get up and move around. The more you're up and moving around, the better. If you ever have bleeding from either incision site or vaginally that's as heavy as a period or heavier from vaginally, I want to know about it. If you have a lot of diarrhea, nausea, throwing up, there's always a chance you could that we may have to do a stool specimen, just because you could get C. diff, which is as a result sometimes of the antibiotics. Once again, I'd say take a probiotic too, if you can. That's helpful if it agrees with you. Skin reactions to adhesives. So a lot of times we have patients take that tape off, especially the bigger tape. They're called tegaderms. We get those off within 24 to 48 hours. Because even if you don't have skin issues, sometimes it can really irritate your skin. Usually the steri strips don't cause an issue. But if there's any question, call us. If you have any kind of chest pain or cardiac issue, you go to the emergency room. A lot of it is really common sense, but if you're in doubt, you call your physician, and you call their office, and if the office is closed, it should go to the answering service, and you should get a call back in a pretty timely fashion. And if you don't, then call again and keep calling until you do. It's better safe than sorry. It's important to make the right call. So anyways, when you go to the emergency room, they'll be in contact with your physician. If they have any question, if you're out of town and that's not where you had your surgery, have them call your physician. And once again, there's a good chance the office may be closed and they'll get the doctor, or, in our case, it's either me or one of the doctors is always on call. But we want to know about it, and we're happy to talk to whoever is there in the emergency room, or your physician, or whoever's giving you care afterwards. But they will assess the patient. Usually we have them do labs, draw your blood, and just make sure everything's okay, check your urine. If they'll listen to your lungs, if for any reason they hear something, we'll have them do a chest x-ray. If your bladder's full, you can do a bladder scan. And sometimes you may need to have your catheter put back in and just left in for a couple of days to kind of give your bladder a rest. A CT sometimes with contrast, just to make sure there's nothing else going on that we want to be aware of. If you ever have calf pain that is localized or red or hard anywhere, but especially it's most common in your calf, we would have them do a venous Doppler study just to make sure you don't have a blood clot. But any kind of pain anywhere that is intense or area that's reddened, you call us and let us know. So those things are all really, really important. Just remember, you're the captain of your ship. Everyone should be focused on giving you the best possible care before, during, and after surgery. If you have any questions or concerns anytime, please do not hesitate to call. It's important for your doctor to know short-term and long-term how you're doing. So hopefully I've left us enough time for questions. But I just want to thank everybody, and I know this is a really difficult time, besides all the normal things that you have to deal with on a daily basis, and then on top of it, all these other things happening. And I think the important thing is just to use common sense, be safe. If you have any question, call your physician. And, you know, we love you guys. We want to take the very, very, very best possible care of everybody. That's why we do this. Thank you.
Thank you so much. So we actually got quite a bit of questions, so we probably won't be able to go through all of them just for the sake of time. But I can go ahead and ask some that I think maybe the presentation didn't go over. Just so we don't go over the same information twice. But we did receive a question from Maya, and they asked, what advice would you give to a support person who is helping someone through an endo journey and that patient is ready to throw in the towel or give up?
So the patient is ready to throw in the towel and give up?
Mm-hmm.
Okay. I think it's important to help get them to someone who will really listen to their needs and what's going on with them, to be supportive and to be patient with them. Also, to reach out to a support group for them with other patients and other people who are going through similar types of things, because you'd be amazed how many people are going through this all over the world. And but make sure that they are getting the proper care, because it sounds like there's a lot of frustration going on there, which is a normal thing that we see all the time. And if there's anything we can do at Center for Endometriosis Care, do not hesitate to reach out to us. We will try our best to put you in touch with the proper places to help you.
Thank you. And then we have another question from, sorry if I say your name wrong, I believe it's Lise. And they asked, is robotic excision surgery better for the patient's recovery?
There is absolutely no evidence of that. You have to keep in mind that robotics is laparoscopy. Oftentimes with robotics, you may even have one or two more incisions. I think it depends on your surgeon, because the recovery should be similar regardless of which approach it is, whether it's straight laparoscopic excision or robotic excision. So I think I would not say flat out that one is any better in any way, shape, or form than the other as far as recovery.
Thank you. And then one more question is, how can our partner prepare and help us recuperate smoothly?
I think the most important thing is that they need to have empathy and compassion for you, and I think that that's why I encourage you when you go for your pre-op visit, if possible, to have them included and to make them feel like they're part of the whole thing. And so as you're getting educated, they need to be educated as well. And so I think that patience, empathy, compassion, preparing before surgery with all the things that you might need after, you, and you need passion for them too, that because oftentimes if you don't feel good, and they're trying to do the best they can, it's frustrating for them. But they need to, initially when you're feeling really, really lousy, they've got to try to be, I think if they understand and appreciate more what you're going through, they'll have more compassion and understanding. And I think that whenever you possibly can, to show your appreciation for what they're doing is good too.
Definitely. Well, thank you so much, Wendy. We really appreciate you sharing your expertise. on this topic. And I just want to let all of our viewers know to please go ahead and follow us on our social media. We do have a Facebook, it's at Endometriosis Family Support Group, and we also have an Instagram, and it's at Endo Family Support Group. So please feel free to follow us. If you go on our website, www.rmccharity.org, you can find further information on all of our upcoming webinars as well. So I just want to go ahead and thank you all for taking the time out of your day to view this webinar.
Thank you very
and
much for giving us the opportunity
as well.
And I want to thank everyone at, I'm very, very fortunate with Center for Endometriosis Care. Thank you to Dr. and Mrs. Sonervo for everything you all do, and Dr. Arrington, Dr. Sonervo's associate, and Heather Guadone, our program director, and all the people we have that we work with. We have an incredible team in our office and in the operating room and pre and post-op, and just on all the support people that we work with after surgery. Shannon Cohn for everything she's doing with Endo What. If you don't have that video, you need to go to our website and find out more about that. It's incredible. It's wonderful for school nurses. And thank you very much to everybody. We love our patients. We love all of you and everybody with endometriosis. We wish we could, we just want to help you in whatever way we can. That's what we believe in. We feel very strongly about it. All of us do. Thank you, Bianca. Thanks.
Thank you. Thank you for the work that you do. And lastly, we're going to be sending a copy of this presentation to everybody that registered, so you will be receiving it for your reference. So thank you, everybody, and have a great rest of your day. Bye-bye.